Hi guys, it's Ariana here at the AAFE Training Center. Today I'm just going to walk you through a little bit of a treatment on my patient that I did where I'm focusing on her lips. She is actually a lip filler first timer, so she's getting her treatment done for the first time here. And I did backfill my syringe, which is something that we teach in Master Lips or Level 2 dermal filler courses. So I'm just working on her. I'm doing standard volumization and Master Lips technique, which is just really allowing me to kind of be a perfectionist a little bit and tackle her lips from all angles. So I'm kind of working on that with her, slowly but surely working around the lips. And you can see how nicely it's just filling out for her. So I'm kind of tackling from a different angle, reassessing, massaging, and tackling it again. Ironically enough, actually, this is a couple days later, and she did message me wanting more, which I feel is the kind of typical thing that you'll hear a lot from patients is they're a little bit nervous starting off, they get a little bit of filler, they become obsessed, and then at their 2-week follow-up, they always want a little bit more. I feel like that's always kind of to be expected. You can see I'm kind of jumping all over the place with her, and I do this pretty frequently with clients. The main reason is because I just topically numbed her, and I'm coming in and I want to give her like a little bit of that lidocaine in the product all over. So for her, I'm really just trying to make sure that she's very comfortable, and you can see she is. But I really like to kind of do a little base all around the lips so the patient does become comfortable while that topical numbing is still kicked in. And then I'll just go back and be a perfectionist after the fact. The reason being, I mean, you guys all know if you start on a Cupid's bow and then you do half the bottom lip, that the time that it takes when you get to the other lip, they start to really feel things. And then I feel as a provider, I don't want to cause them a ton of discomfort. So I always end up feeling bad, and so I do this little technique where I just do a little bit of product all over the place, which is great. So she's very comfortable, as you can tell, so I'm kind of taking advantage of that. And I am doing standard volumization here for her, and now I'm going to come in with right angle technique. Again, this is Master Lips technique versus standard volumization is something that we teach in Level 1. And it's amazing because this technique is not only precise, but it helps give you very even spread. And then I'm just going to work on kind of tackling her lips, massaging, and making sure it looks how I want it to. Now, looking back at this, it's really cool to see how much her lips really took to filler. I mean, it looks really, really great, and it's kind of holding structure the way I want it as well. So I was very happy with it. She was very happy with it, which is all that really matters. So looking at it too, I can definitely see where I want to go back on the right Cupid's bow, but because I'm trying to get her numb kind of all over, that's why I am not yet, and I'm giving her even spread everywhere. You can also see she has a little bit of an M-shaped lip. With that being said, you have to be really careful in that area. It's really hard to give patients their dream lips on the first treatment. But trying to keep in mind that she wanted to keep her lip shape. She just wanted a little bit more plump and hydration. I didn't want to go too crazy on this first treatment. I didn't want her to feel overwhelmed. We can always add more. So I kind of kept it light, carefree, all over the lips, pretty even spread. And like I said, she was super happy with them when she left, and now she's wanting a little bit more. So you can see too, not crazy big lips. They definitely suit her face. But super happy with it. I'm just trying to kind of clot off that little bruise, that little hematoma that's there, putting some pressure on it, making sure that I have even spread. And now is when I go in and kind of be OCD about everything. So yeah, just kind of working my way around. Obviously, if you were ever concerned about anything, checking capillary refill is huge. So I would have started there if I was concerned, but it's definitely just a little baby bruise that I have going on. And definitely if you were concerned, don't continue to inject around it, but I'm very confident that it wasn't anything of concern. So we did do cheek filler, jawline, and a little bit of chin. We did cheeks at this appointment, but we've done a lot of work in the past We've done collagen stimulating products. We've done filler kind of all over. So for her, I was okay with adding just a smidge to the nasolabial folds. A very soft product. I did numb her here just to make sure she was comfortable, and now I'm just kind of checking where I want to go. I don't love too much in this area just because she's young. She doesn't really have any kind of deep creases, but she was trying to get a little bit more support in that area. So I am just adding a little bit. Aspirating, of course, and just being really careful with my injections. So with that being said, I'm not doing anything crazy. You can see how little I am injecting in this area just to add some support and kind of give structure where she's wanting it. And again, she was super pleased with everything. Make sure you know your anatomy in this area, your depth, what you're trying to avoid, what you're trying to look out for if you had any concerns. So that's always huge. I do know my anatomy well, so I was not concerned with my depth. But you should know kind of what arteries you're trying to avoid, where you would see blood flow moving if you had any obstruction, what to do, what product you're using. And I'm really not putting a ton of filler here either. We talk about this a lot with level 1, 2, and 3. We call it the injection perfection protocol, which is basically our safety mechanism just to make sure you know what you're doing. Where you are, your depth, how much you're pushing, everything like that. So I'm just going to clean her off, put some arnica on that little bruise, make sure she knows where it is and to help take care of it. Perfect. So I'm just kind of working my way around, cleaning her off, going to talk to her about post-care, what to keep track of, what to keep me notified with, and our follow-up time. And you can see it was just a little bit more plump, but I kept her lips. I'm pointing things out, checking cap refill, and then she's going to go on her merry way. So I hope this was helpful, and I hope you guys learned a little bit from here. Thanks for watching.